Okay, Dr. Liantonio, I just want to thank you again for doing this interview with me. Let me just introduce you first. Dr. Liantonio is a physician's assistant for the cardiac division at Long Island Jewish Medical Center. And basically, this interview is about smokeless tobacco and all the ill health effects, associated with it. So let's get right to it. The first thing I want to ask you right off the bat is, what would you say the biggest overall danger is with smokeless tobacco use?
I think the number one danger associated with smokeless tobacco use is oral, and actually are oral and throat cancers. That is the number one adverse effect associated with smokeless tobacco use.
And with a product like this that has so many bad health effects, why is it, do you think, that people do it? Is it because it's highly addictive, like cigarettes? What is it about the smokeless tobacco that people are so addicted to it?
That's correct, Matt. Smokeless tobacco does have a component of nicotine, which is a drug and is addicting. And then in the same respect as smoking, where people talk about oral fixations and having to constantly put something in their mouth. Usually they describe that when they they use cigarettes during the day. It's the same effect with smokeless tobacco. They develop this urge that they fulfill with the smokeless tobacco and constantly chew it.
Now, from your dealings at the medical center where you're at, do you notice any different age groups that you could associate with smokeless tobacco? In other words, do you see mostly older people? Do you see mostly younger people? Who are the main people using this?
Unfortunately, in my current practice, I work with a lot of elderly patients. So most of these people have smoked tobacco for most of their lives. I don't have a large population of smokeless tobacco patients or patients that use smokeless tobacco. However, the literature shows that the numbers of young adults using smokeless tobacco is increasing, and that is a major problem because honestly there really are some major side effects, and oral cancer is not something to play with. It's very hard to find. Oftentimes it's under the tongue or located in areas on the sides of the mouth that people can't see regularly, and so it's only found maybe in a dentist's office if that dentist is aware of your history and actually is looking for these problems. Otherwise, it can be in advanced stages before it's noticed. And in young people, that is something that probably would go unnoticed for a long time. They're not really concerned with dying when they're 20 years old.
So when we see all these young people who are using it, and being that it's so dangerous because it's so hard to find, what would you say would be one of the most important things moving forward in terms of getting this young generation to quit? Ways to find different alternatives, or just ways in general to quit so it doesn't become a real problem like cigarettes have become?
That's a good question. I think one of the ways, much like smoking and how the government and federal agencies have dealt with that, maybe one of the things we can do is increase the prices of smokeless tobacco and increase taxes so that it's not a very favorable price to pay. We can also increase advertising from a young age and just show people really what can happen to them as a result of long-term chronic use. And then the last thing we can probably do is maybe enforce some sort of restriction on people, or I don't know, some sort of, along with the advertisement.
Right, in terms of making people more aware of it.
Right, make more aware in public places, maybe in schools. Maybe we could show more advertisements and have seminars, community events that can educate people and be available for anybody that may have questions or concerns.
I appreciate all the facts and the knowledge you given. I'm building this website and, trying to make people more aware of the dangers of it. And, if there's one last message before we finish and wrap up that you would give maybe anyone who would see this website and maybe would tell a friend, or maybe it's about themselves, is there any message you could give, overall big picture, before we wrap up?
I think the one thing I would advise patients and people that are either thinking about engaging in smokeless tobacco or are thinking about or already using and maybe thinking about quitting is that maybe you should research this a little bit more and think about the negative consequences that are associated, because I see many people that we take care of in the hospital where we remove pieces of their jaw and remove, limbs and extremities as a result of disease. This is something that's preventable. You can avoid using these products, and you'll keep your body in one piece. I think that's something that's overlooked, that this is a preventable product. People do not have to use this and can remain healthy.
Well, you've definitely made whoever would, be listening to this interview more aware, and I just want to thank you again very much for taking the time out to sit down with me, letting me come here to your office, and I really appreciate the time.
Thank you very much.
Okay, thank you.